Hi, Dr. Morey, Uncivilized Vitality, and this video is about our 3 lost abilities and some of the 5 vital path components. So the 3 lost abilities, the reason we practice the 5 vital paths and the field craft and follow the 13 philosophical points is to develop those abilities that humankind has lost since we've become civilized or too civilized. Any civilization is too much, honestly. Capability, adaptability, and durability. Right, we used to have these 3 abilities in spades, thousands of years ago. Human beings have since gotten less capable, less durable. We're very soft. And then our adaptability has also gone out. And what I want to talk about specifically is this loss of durability in a phenomenon of civilization called medicalization. Right? So a lot of things that used to be thought of as just part of life, right? Eventually we're all going to get old, we all get sick at some point, and we all die. Those are just facts of life. And they used to have the ability to deal with small aches and pains, the occasional twisted ankle or small cut or an irritating rash like poison ivy or a headache, low back pain. Was it something like 70, 78, 80% of people enter the healthcare field due to low back pain, seeking some sort of relief from that. And I will tell you, as a physician, that low back pain almost always will get better on its own in time. Now, if you want to seek the aid of getting some physical therapy, exercise, seeing your chiropractor, going to the doctor in order to speed that process up, instead of 3 months of sort of a lingering ache, you can reduce that to less than a month. Obviously, that's your want, but they almost always get better by themselves. I think, I can never remember who says this. Used to say, somebody said this once, it's the role of the physician to amuse the patient while nature takes care of the cure. I want to say it was Voltaire, which doesn't sound right, but all right, somebody can Google check that. So our durability has gone down. We've been trained or civilized to over medicalize. Every little ache and pain, every little, as we get older, we get into our 40s, 50s, and 60s, we want to feel completely pain-free, no discomfort at all. We're addicted to comfort, and we'll start to seek solutions for that. And then the medical or healthcare model in general nowadays is designed to meet that need. And then they fan the flames of that need with drug commercials. Pharmaceuticals have advertisements on TV all the time. Usually they're really weird. They're upbeat, happy. They're using psychological tricks on you. Happy, upbeat music, and then there's just a list of horrible side effects at the bottom of the screen for which you would never put up with or take a chance, but they make it seem upbeat, and they've got us trained to ask your doctor. And when diet and exercise aren't enough, diet and exercise are almost always enough. If they're not, there's a few circumstances when they wouldn't be. Those are 3 causes of dis-ease or problems that you would require medical profession or seeking the advice of a physician. We had trauma, toxins, and thoughts. Right? Direct trauma, you get hit by a car. I got hit by a car. I broke a lot of stuff, and I was very thankful to have the hospital and the emergency medical response team keep me alive. And it did a pretty good job helping me recoup. Although I did most of that on my own, the exercise and such. But that's what you want that for. If I get poisoned or eat some kind of toxin, there are powerful chemicals and pharmaceuticals, which are patented chemicals, available to help me return to homeostasis or hopefully balance on anything that might otherwise kill me. But your day-to-day things, your headache, you slept funny, you woke up, little aches and pains, we've been taught or civilized into ignoring our durability and just getting on with our day and then seeking help for that. It's called medicalization. I talk to my pregnant patients all the time to remind them that you are pregnant, you are not a patient. Pregnancy is one of the most natural things that's ever occurred, and women have been getting through that since literally the beginning. And of course, there are some downsides or some risks, but they're not nearly as large as you've been maybe led to believe by media and television and civilization in general. One of the 10 C's, if you've read my book, one of the 10 C's of unintended consequences of civilization is comfort. We're addicted to comfort. Right? And medicalization comes in three parts. Overdiagnosis. We'll talk about what that is in a minute. Overtesting and overtreatment. Overdiagnosis, overtesting, and overtreatment. And this is some advice. Hopefully you read the disclaimer at the beginning. This is just, this is not medical advice per se. Let's call it, because of YouTube guidelines, let's call it general advice to all the uncivilized out there. Watch out for these three. When you go into your doctor with a complaint, watch out for overtesting. The easiest thing you can do is ask the doctor, what is this test for? Is this just confirmatory? Are you just searching for something? What will the outcome of this test change as far as treatment goes? For instance, I rarely x-ray a patient. I'll x-ray a patient for a direct trauma. If I palpate or suspect a fracture or some kind of ligamentous injury or something, I might order some imaging just to confirm what I'm 99% sure of. But I don't send people for x-rays just because. Because over-testing, let's say x-rays for instance, that'll lead to over-diagnosing. Over-diagnosing is something I also warn my patients about. Let's say you are 45 years old and you come in with low back pain and your chiropractic physician sends you for an x-ray. They're going to find things on that x-ray. No 45-year-old has a perfectly healthy spine. There are going to be osteophytes and bulging discs and calcifications, maybe some Schmorl's nodes. There's going to be something on there that you were living life just fine not knowing about. There's no danger. It's not going to progress. What I just read recently that something like 30% of people have undiagnosed and untreated thyroid tumors that will be there the rest of their lives and cause no problems at all. They're too slow growing or they're benign. And if you happen to find that, incidentalosis is the name of that condition. Your doctor finds something, now it's in your head. Doctor will show you the x-rays, and instead of just saying your low back pain is one of those intermittent occasional things that happens, maybe you overdid it on the raking or the snow shoveling this time of year. And now because I sent you for an unnecessary x-ray, now I've found osteophytes and other things that then I will, this comes to over-treatment. Then, not me, but this hypothetical doctor would then say, ooh, look at that bulging disc, or look at this, or look at that, which wasn't causing any symptoms at all and probably wouldn't cause any symptoms. They'll say, we better treat that. Now all of a sudden you're being over-treated. You're in there on a long treatment plan, or you're getting drugs you don't need, right? We get into how when they made pain, right? They made pain the fifth vital sign. This was pushed quite a bit. Now they always ask you, what's your pain on a scale of 1 to 10? By giving pain this overemphasis as importance, keeping on there with the other vitals, right? Breathing rate, heart rate, your blood pressure, right? Your temperature, things that are actually vital to being alive. Pain's not. Pain is subjective. It's different from everybody. It's a terrible way to base treatment on just somebody's conception of pain, right? Recently, my son had a pretty serious fracture of his tibia, required surgery and fixation and all sorts of things. And the nurses would come in at night and ask him about his pain scale. And not having been raised to put pain at the top of their list, my 4 boys, he would say, I don't know, 3 out of 10. Which always seemed to surprise the nurses because he hadn't had any painkillers yet. He just got out of surgery. And to him, and he even explained to the nurse, he didn't want any painkiller or a low dose of painkiller to sleep, but he was afraid that if he was numb to that pain, that he might inadvertently move it and cause more damage. That's a smart thing to do. All right, but pain is the fifth vital sign. A lot of times will lead to over-treatment because we're doing everything we can to escape this pain or slight discomforts. And again, this is not to say that you should ignore things or not go to your doctor if things become concerning. It's been my experience with patients, though, that if they're if their concerns are acknowledged and addressed, and you can slowly talk your patient kind of off the ledge, give them some realistic outcomes and some probabilities, like could be this, and let them make that decision. Give them the risk and benefit analysis of treatment, because there are always you can't just treat things. Treatment's not always risk-free. Sometimes there are risks inherent in certain treatments or certain solutions to conditions that can lead to more problems, and you should be aware of those. The loss of our durability, the inability to put up with even minor aches and pains or discomfort, leads us into the over-medicalization, over-diagnosis, over-testing, over-treatment of things that otherwise wouldn't be necessarily requiring treatment. Okay? Pre-civilized human beings in normal human societies had to put up with a lot of aches and pains and little things. And sure, there are some negative outcomes from that. Sometimes you have some trauma that can lead to death that didn't get treated. I understand that. I'm not talking about those things. And it's been my experience that patients can tell the difference. A lot of times, if you're not used to little aches and pains and you get into a situation where you're suffering a pain, you don't know whether it's serious or not. And that is when you need a physician whose opinion you can trust. You can come in, and I find that, again, this is just me, anecdotal, my patients seem to respond better when I can say, this only hurts, you're not doing any damage. And then they seem to recover much quicker with whatever is going on. Because a lot of times, if you're not a physician or an anatomist, or you're not familiar with how the body works, and almost none of us are anymore because they've deliberately civilized our durability and capability out of us, you'll think, uh-oh, is this a pulled muscle, or is this, some kind of shoulder tumor? You don't know. So you go to the doctor. And because medicine and healthcare in general now is a business model, and as a business model, sadly, the whole idea, hospitals and pharmaceuticals especially, it's a for-profit business model. Business models are beholden to the shareholders and turning a profit, not the health and wellness of their patient. So, necessarily. Man, this YouTube's not going to like this one, I bet. Sorry, Rendell, if this one gets all flagged or whatever. But generally, you want to be careful not to over-medicalize or medicalize your own somewhat normal conditions by getting to be a little more durable. A lot of things will pass. One of the hardest things to do when you've got a little ache or a pain or a headache or something is to wait. Wait and see. Just wait and see is one of the things you can do. Wait and see. Give yourself a time frame. So, man, I woke up with a killer headache. Is that an oncoming stroke? There's quick screenings you can do at home. Raising your arms. What day is it? What time is it? Smile in the mirror. You can Google those quick ways to check if a stroke is occurring. Heart attack. You know the sign. Look and learn. Be capable of distinguishing a heart attack in yourself or loved ones, or have somebody around whose judgment you trust and you know they're capable of spotting these signs. Start to learn to distinguish and learn the signs that require an ER visit, right? Not every ache and pain requires an ER visit. Learn the signs, become capable, wait and see, a little more durable. That one's kind of hard, but one of the things you can do is give yourself a benchmark. Say, you know what? I do this all the time because I make poor decisions with my jiu-jitsu and parkour and stuff at my age, my mid-50s. I'll tweak my knee or wrench my shoulder, and I say, okay, this really hurts. I will give it 2 weeks, and I give myself a benchmark. Some of that's through experience, but you'll get the hang of it. You say, you know what? If it's not better in 2 weeks, if it's not 50% better in 2 weeks, I'll have someone look at it, or I'll get an opinion. Or maybe it's something else, like if I get a cut, I clean it out, I close it, I treat the cut. And then I look at it and I say, well, I'll give it 3 days and we'll see how it's going. If it gets pink, if I develop a fever, or if I have any of the signs of an infection, then I might seek some aid. But learning to distinguish these things yourself at home will keep you from medicalizing little day-to-day things that everybody has to deal with. And that way you'll avoid overdiagnosis, overtreating, and overtesting, right? So wait and see, learn the signs, and here's another one. Exposure. slowly accommodate yourself to small aches and pains. Try to develop being more durable. Okay, the more durable you get, the less likely you are to over medicalize something. Now, like I said probably a couple times or alluded to, this can go too far. Don't be the person that never goes to the doctor. Know when it's time to go to the doctor. That circles back up to learning the signs and having enough humility to say, you know what, this is out of my depth. I better get somebody who I trust to give me a second opinion on this. When you get into the medical field, be aware of overdiagnosis, right? Let's just see what's going on. People go to the doctor for two reasons. They want to know what's going on, and they want some sort of palliative. What can I do about it, right? What's going on? What can I do about it? A lot of people are just satisfied to know what's going on. Like I said, I know many patients that'll come in. I only see them maybe a couple times a year. They'll come in and they'll say, I've got this ache or whatever. We'll do an exam. We'll take a history. We'll figure it out. And if I come up with a diagnosis that feels strong to them, explains it, then they feel better knowing that it's nothing dangerous. It only hurts. And then they're usually good to go. And they notice that it gets better right away once you know what it is. If your doctor is going to start ordering a bunch of imaging and tests, find out why. Are these tests necessary? How is that going to change the outcome? What impact will this have? Right? And then over treatment. You need the minimum amount of treatment. Doctors really don't do anything. The pharmaceuticals, the powerful drugs, the physical manipulations and physical medicine, the surgeries, all those do is facilitate your body healing itself. So keep that in mind and don't sign up for a whole bunch of over treatments. And then employ these things in your life to start becoming more capable and durable. One, wait and see. Give yourself a deadline. So you know what, if I'm not better by tomorrow or 3 days, then I'll go see someone. And stick to that, right? If you're not better in 2 weeks, don't extend it another 2 weeks. Keep your promise to yourself and go get it looked at. Learn the signs. Become familiar with the basics of how your body works, its basic anatomy and physiology, and at least have a rudimentary understanding of when you need to see a doctor. You notice that very few people nowadays actually understand what's important, what's not important, and we want to abdicate all that responsibility over to the authorities in the healthcare field. Remember, their business model is designed to maximize profits, and to do that, they need widgets. They need people in there as often as possible. Don't know what it is? See your doctor. Screenings. Go get screened for this, that, and the other thing. If you're constantly being screened for things, you're going to run the risk of overdiagnosis. And then exposure. Start to practice getting used to little aches and pains, and you'll find it's not that bad. And you can get on with your life, because life eventually is going to give you aches and pains. You can't escape that. You can't you can't avoid discomfort. So it's better to embrace it and get used to it. Then, when it does occur, you'll know the difference between an ache and a pain, or some sort of ailment you can contend with until it heals, and a quote-unquote real one that you need to go and see a doctor and get some help for. So our 3 lost abilities: capability, adaptability, and durability. That's part of the UV training. If you follow the 5 vital paths and get as healthy as possible, and then when you'll be better at not being medicalized. When you do need the medical services or mainstream medicine, emergency care, they're great when you need them. Most of the time you don't need them. If you want to stay healthy, follow the Uncivilized 5 vital paths. Move on purpose, eat on purpose, rest on purpose, keep yourself clean and on purpose, and the prevention of disease. Prevention beats curing, right? So read through the book, check that out, follow these simple steps when you have a pain, learn the signs of seeing what's actually life-threatening or is an honest-to-goodness ailment before you go into the medical field. Maybe give yourself a deadline and then start practicing a little bit of exposure to aches and pains to develop your durability and your capability of distinguishing between a real ailment and just being alive. So hopefully that little rant about medicalization will fly through with YouTube. And also, maybe go back and read the disclaimer again. This is just for general information purposes. What else? You can, I think I do this right. I do this and a little box appears. Rendell will put the Buy Me a Coffee link up here. You can donate to the channel or buy us a coffee, which is the phrase, and that will help support the ULF and the UV in general, check out the books on Amazon.com or contact us directly at info@Uncivilized Vitality. Join us for one of our events. There's no better way to develop your durability than camping in northern Michigan in February or January. That'll harden you up real quick. What else? I think that's it. Like, share, subscribe, leave some comments below.